everybody. This is Erica Mello and Susan Clinton, and we are Tough to Treat. And this is part 2 of the patient who had the cranial source to his sense of feeling twisted and multiple joint pain. And I hope you really enjoyed part 1. It was quite a learning experience for both of us, and it's a great podcast to listen to over and over again because the clinical reasoning process, I think, is pretty amazing. And it is nice and cool here in New York now. It's probably now like at the beginning of November, and Thanksgiving is in the air. So everybody have a wonderful fall, and hope you enjoy part 2. This is a continuation of the prior podcast of a patient of mine who had major issues with being twisted and neck spasms, and I determined that the source of his problem was indeed his cranium because of all the head hits and all of that stuff. And so I did follow up on several things you had suggested. You had mentioned doing some peripheral nerve glides and slumps and really wound up positions like in thoracic or long sit slump, and doing nerve glides in that position and things like that. So I can tell you what I did do and how he came in. So he's actually leaving on a trip in a couple of weeks. I was just telling Susan everybody goes away in July and August, so it's like we have time to actually look at our notes and do chart reviews and things like that. So he came in, and I do always do my general listening with him when I come in. That's if you haven't listened to the whole series of podcasts, it's a technique that I learned from the Boral Institute, from the visceral mobilization. In the past, I just put a hand on the head, I give a fascial load, and I was always pulled into his head, and except for the past couple times. So when I did it again this time, I was pulled into his right hip, and I don't tell him anything until after I do it. And I said, well, I'm pulled into your right hip, and interestingly enough, and he had a prior issue with his hip. Secondarily, it never was a big deal because of all the neck spasms and the sense of feeling twisted. So that was the second time in a row that I didn't really feel a pull into his head. And he came in and he was feeling pretty good, actually. He hadn't had a neck spasm in a while, and his sense of feeling twisted really was gone. And he said to me, I always think patients always tell you when they're ready to do something. You tell me what you think. He's like, I think I'm ready to go back to judo. And I was like, yes. Because I think sometimes, especially when we meet somebody for the first time, we don't know if they have a great sense of their body, but that was the first time in all these months I've been treating him that he actually said that. And I said to myself, oh, we're almost at the end here. I'm going to miss him. But but that was nice. But so I did do the peripheral. So what I did is, following up on your suggestions from last time,
okay,
I got him into wound, because he's super flexible.
Right.
He's very hypermobile. So I got him into long sit slump, really wound him up, flexed the feet. Then I had him do some, median nerve, radial nerve glides in that position. And he wasn't, nothing was happening. He wasn't really wound up. He wasn't doing, I wasn't reproducing anything. So I slumped him more. I raised his legs up to really wind up the straight leg raise. And he still wasn't doing that. He wasn't responding. So then I got him into a regular slump off the plinth and raised his legs up quite high, and still wound him up, and he still was okay. And I think if I had done that early on in my treatment, I would have gotten something.
Okay, yeah. So that whatever neural tension then that may have been there had already probably started resolving.
Right. And I think that I asked him, I said, to this, and I think we should, I don't know what you do, but I always ask patients, especially if I've been treating for a long time, I ask them, what, in all the times we've been together, what has helped you the most in terms of treatment intervention? And he did tell me a lot of those, I call them neural glides, but, femoral nerve stretch, but with in a half lunge position, just sort of winding people up, having him do heel slides with a chin tuck on the bed, having him do some lower trunk rotation, moving his arms, but while cueing his cranium, which was his main issue, his source of his problem, or his driver. That was his issue. So every time he did those, he cued that, and he was able to move more fluidly. When he did not do that, when he didn't cue into his brain, it wasn't so fluid.
So discuss just a little bit more, Matt, what you mean about cueing his cranium.
So with his cranium, I felt like way back at the beginning when I first met him, he had this sort of left side bend twist in his head. And that was sort of his whole description. I feel twisted from head to toe way back when. And in a lot of the coursework that I've done, I just put my hands on his head, and then I had him do a squat because sitting was an issue at the beginning. So I put my hands on the head, he squatted, and I felt my hands go into this sort of a twist. It was just his nervous system unwinding or doing was something. And then he would get his symptoms in his neck or in his upper thoracic spine. He had multiple symptoms. And he just said, that doesn't feel right. His hip would lock up. So I said, okay, this is, so I basically, with my hands, I said, this is what I'm seeing with my hands. And I told him, I said, I need you in your brain to cue the other way. So for people who don't know, aren't getting this, just imagine, you've got your hands around his head. And when he squats, one hand is moving backwards, the other hand is moving forwards. It's just his brain unwinding, his nervous system unwinding to get him lower in the squat. But that was symptomatic for him. So what I did is I had him cue more of I don't even know how we just call this, more of a neutral head, or just cue. I just said cue in your brain, and I move my hands, more of a neutral position of your head. That's how I worded it to him, but I was really using my hands. So people who aren't, who are listening, it really was my hands.
So sometimes when I have people who go, when they start to move, they go into a twist, from whatever to whatever, through their trunk and neck and head and all the way through, I'll just kind of, do the same thing. I just talk in terms of your head. Like, I just want, you feel your head and your body twisting in this direction. Let's see if you can do it without that happening, right. and get them to kind of, and sometimes I think it also helps. I don't know what your experience is, but it also helps to kind of exaggerate it a little bit.
Yeah.
And then they're like, oh yeah, and
yeah.
And then it's like, okay, so now let's go, and don't go so far, or let's try to go maybe even try to see if you can do it and twist the other way. And that
right.
bring them in. So, different people respond to different cues. This guy is really, into what's going on in his body. He's very kind of cued into those pieces, and those words made really good sense to him, obviously, because he changed. Somebody else may not be quite as in tune, and sometimes they just need that exaggerated kind of like, see, when you do this, you do this. See if you can do it like this, because every time you do it like this, it bothers you.
Yeah.
Let's find a different way to move. And so to get them to kind of, and just cue them, out of it. Some people need more of a full kind of exoskeleton type of movement pattern than internal. Cool.
Yeah. Sometimes I'll take my iPhone and I'll video them as well, for the visual.
It's always so powerful.
Yeah, it is. So he cued his cranium, and then he squatted, and he was much better. And that was pretty consistent across everything. So with somebody like this, he's not just going to have one thing that bothers him. Sitting bothered him. He wanted to return to judo. He felt tight in his thoracic spine. And this all came out, as we call it, we're peeling the layers of the onion off. So throughout the whole treatment, one part would be good, and he'd feel like, well, then this is, sort of a little funky. And that's normal. And I, depending how many years you have in the field, don't let that intimidate you. That's just normal with these types of people, and you don't want to keep chasing things, but you want to have a methodical approach to how you treat these patients. And I think with him, I ran the course of the cranium. He was done, we were done, because that was much better. So as we got to the end here, and I'm hoping, as I said, he's going away, so I think I have one more session with him, but before he goes, he cued his cranium, his squat got better, his whole sense of being got better. So now when I saw him, I was cued to the hip, and it turns out he actually has an issue with his hip, and he actually had gone to the doctor that week because he's going away. And it was a chronic issue, nothing acute. He mentioned it in passing at one point. So I was going to hold off on that for a second. So I talked about a little bit about what was helping him, and he said a lot of the nerve glides, or that's how we talk. That's how I called it.
Mm-hmm.
I think it's just opening up different lines in the body, and that's why dancing he loves it, because it allows him to do that. But we need to sort of get him to load, and I think that's where we had left off last time. And I talked about squatting because he needs to be able to lift and move his paintings, his boxes of art. And at that point, what was limiting his squatting was his hip, because he couldn't get low enough in the squat. And his cranial cue got him low, but not low enough. So it's common to have secondary or even tertiary issues with these types of patients. Mm-hmm. So I started thinking, well, how am I going to load? He doesn't have to go into a deep squat to start. I said, how am I going to start to load this guy in a more functional fashion? And I don't know about you, but I tend to think sometimes that even though the issue may be in their cranium, or it could be an issue with their knee or their shoulder, we need to train them across all tasks, all ADLs, whether it's squatting, right, lifting their arm, like in New York, to hail a cab, or to or putting something up on their, even if he has a knee problem, we need to train his arms to put something up on a shelf. Don't you feel? Don't
yeah, absolutely, absolutely. Because I think that we need to be sure that we're not just moving in, one directional types of movement patterns, but all of those movement patterns are important. And since you spent so much time working on the mobility of the nervous system itself, it makes sense that you would want to take it with arms overhead and loading, and down low into a squat and loading, and into the movements and rotation, because you want to build that functional context around the new mobility that he has found.
That's great.
The new mobility that he's got the change of symptoms in.
Mm-hmm.
Now you want to load that and strengthen those new mobilities so that they become, embedded into the, whole central nervous system movement pattern things.
Yeah,
so,
great point.
Yeah, I'm a big one on loading in whichever direction you can go, as soon as you can actually get them to start doing it. Yeah. And you actually started in the beginning because you picked a loading event to change right away with him, and one that you knew he was going to have to do the minute he walked out of your office, because you found out what was important to him.
Yeah,
and he needed to move his art around.
Yeah, I know. Well, that's a great point too, because we were doing arms and legs, but I think sometimes people focus on just one aspect, and I think these types of patients that I like the analogy of the nerve glides with moving the arms above. That's great. That's something that is so important. And so I think that's where I'm at with him now. I'm having him, I'm hopefully going to see him this week, is having him just put things above and below and twisting and really heavy. And I think he'll be okay. And the ironic thing is, I said to him, you feel you're ready to go back to judo? And he said, yes. He said, I think I'll be okay. And I said, I think you will be as well. But the issue that it was concerning to him at that point was his hip, ironically. So I treated his hip, and this is a straight articular joint problem that he's had for a long time. And I did basic, posterior capsule mobs with belts, the mulligan, and that I did. And what was interesting, and I did that for a fair amount of time. I don't know how long, if you have a straight articular problem, how long you mobilize. But I was in there with the belt for a good 5 minutes. Trying to, because it's a long, chronic, stiff joint, and once again, not his main issue, but as we peeled the layers of the onion off, as I keep saying, this just showed up. And I think that people, especially the complex ones, if you see them for their main issue and then you discharge them and they still have some lingering things, they're going to come back. So I think you really need to clean everything up and then sort of set them out and let them go. But, how long, I mobilized him for a bit, to be honest, and that really helped. And what was interesting is after I did that, because I didn't need to do anything else manually at that point, so I had him stand up, and he just said, oh, Lord, my entire back released. He's very sensitive nervous system, and every little thing. He's not the less is more patient, but it doesn't take much to get a big change in somebody like that, So I mobilized that. He said everything felt fabulous. I was like, oh, great. This is wonderful. If it were that easy the entire time I've been seeing him. But I don't know what your thoughts are on doing anything articular, but that's what I did with him for that particular issue.
Yeah, my background is in, bone and joints for sure. And, the joint itself. And sometimes I think the joint is a little bit overlooked in all of the different things that we do, because we do have, we can have sensitization set up around our joints, but we can also have some mechanical things going on as well. And not to say that there's one right way to jump off the ground or to land on the ground. I've gotten away from that, if the knee goes medial, that's terrible, more about what's kind of actually happening with that person as you look at the whole thing. And what you've been doing is looking at his whole body for so long that you had worked and changed a lot of different things, but some stiffness was still there for whatever reason it's set in. If it's collagen stiffness, if it's muscle guarding and holding stiffness, I think that when we go in and mobilize, we may not know which system we're working on, but we know that we're actually going in the direction that we want the joint to go. And I think that's, until proven otherwise, I think that's kind of the point, when I go in and do that kind of thing. When it feels chronic and stiff, I think sometimes that nice holding is really good to do. That's why I love belts, because you don't have to be aggressive. I know people look at belts and they start thinking about, putting somebody on the rack. And I actually think it's the opposite. I think it's actually just a nice way to get, the joint in the position that you want, with the pull going the direction that you want. That's really going to go with normal biomechanical physics of roll and glide. And, when you're going after the posterior capsule, you're really looking at that, glide and also that roll of the femoral head. And, and I think that sometimes some people respond really well to that nice, slow kind of hold, where others, if it was a little bit more of a painful, sensitive joint, oscillations might have been something that can go in and actually change the input into the nervous system.
Yeah.
It's just one of those things. How do we know? We do joint mobility to kind of see, is it stiff? Is it really holding? Now, again, this is where I'm kind of running up against my conformational biases, is it always collagen?
Right.
Or is it sometimes, or is it the brain just gotten so used to just protecting that joint, for whatever reason, that it's a pattern that's set up that is just strong as can be. I think the coolest thing is that you didn't have to sit there and pound on him for 30 minutes and bring him back, and 3 times a week continue to just, fudge away at that joint. You did this great technique for about, like you said, a good 5 minutes. Most people would say, oh my God, that's all she did?
Yeah, that's all I did.
And you're like, 5 minutes, woo, that's enough. Let's get out, get moving, going again. The coolest thing was that the reassessment, I think, is the key there.
Yeah.
We did this. We put this novel input in. Did you have a conversation with his brain while you're doing that? Of course, because the nervous system's always listening. But you were also kind of working on mechanics of the joint, I think, in a little way. And maybe the brain begins to feel that, the joint can move that way. That's kind of a cool way to get it moving. It's like, do we squat or do we put them on hands and knees and have them sit back? It's the same movement. It's just a different way to get into that movement. And so the joint itself can respond in different things. And sometimes I think that just that good, great hands-on approach to just kind of doing it, that holding it, and then reassessing, did we make a change? And if so, how can I help him keep that change, which is what you're trying to do with the loading piece.
Yeah. I know, it's funny. I gave him on your hands and knees and sitting back and putting out his leg in a little bit of external rotation. One of the old Shirley Sarman exercises I learned years ago, and he did do that, but for his home program real briefly. And I said, let's just watch you squat, because that's the most important thing. And he squatted literally right to the ground. And I was looking at him. I don't think I could ever get that low, but he, no issues with the calves, no ankle issues. And what was interesting, speaking of his foot, way back when I think, I'm not sure if I mentioned this in the podcast last week, but he asked me about, should I get orthotics? I'm like, no. And the reason why is that, he had, some mechanical issues with his foot. So I just sort of neutralized his foot. I just literally, in standing, a technique just to neutralize the foot I've learned and get the rear foot in neutral and, give me a little bit of an arch. Anyway, when I did that, simulating like an orthotic, his entire body was twisted. I'm like, no. That makes everything worse in your body. You do not need orthotics. So that's just an aside. So
Mm-hmm.
when he squatted, everything looked great. He felt a lot better. So that's really all I did for his hip. And he, my guess is it'll stiffen up a little because it's a chronic issue, and he may need a little bit more of that. But I gave him a technique. I don't know. This technique, I tried to get him to do at home. I had him sort of finagle a belt around his thigh and push off, a wall. I don't know how you would do that besides giving them all fours into all fours, but he wanted to do something with the belt. And I've always had an issue trying to give people, I don't know, a simulated belt home exercise program for that
Mm-hmm.
particular mobilization.
Mm-hmm.
He said he would figure something out, but I haven't seen him since then, so I can ask him. But that's what I did with him there.
Mm-hmm.
So in terms of his exercise program, just to recap, I started him initially in unloaded positions. Supine, having him doing some reverse flies, having him do some skull, I call them skull crushers, tricep extensions. Then I had him do, this was a while ago, and that's where I started his program. And now, fast forward, he's at the point now where I need to get him into functional movement, and he's been doing that, but mostly straight plane movement.
Mm-hmm.
And now I need to get him in especially three-dimensional movement for his return to judo. So I think I'll start with, and you can, intervene here, Susan. I'll probably start with him doing the full arm loading with, squatting, because I think he was just squatting to the floor. Now I'm going to have him do the full arm loading, simulate those neural glide positions, and maybe having him squatting with some weight and just reaching and doing some, side lunges, things like that with weights. I mean, just to get him to load the upper extremity as well as move within those 3D parameters so he can return to judo. What are your thoughts on that?
Yeah, no, there are two or three things that I loved. One of the things that I thought was interesting was you were, because everybody always talks, and I might go back to the foot for a minute, everybody always talks about a neutral foot, that we have to have a neutral foot.
Mm-hmm.
And what is a neutral foot, and what does that mean? And I think that, hopefully we're all kind of moving away from that a little bit. But, I love the idea that, you basically, what you did with his foot was you just got him to stand a little bit differently to see how it affected his entire system.
Right.
And it didn't really feed into the direction, it fed into a direction that was problematic for him.
Yep.
Hopefully that direction in the future won't be problematic for him. But, at the time you were doing it, it was problematic. So you wouldn't want to keep feeding into that. So you had to let his feet do whatever his feet needed to do to go into a squat. And I think that's really, really important, is that it's okay for the feet to, drop the arches somewhat. It's okay to maybe evert at the calcaneus. It's okay for the toes to, do where they're going to go, and in some instances, I think if you think about eccentric to concentric, or load, before you kind of, what is it, the Gary Gray stuff, load to explode.
Right.
So you've got a guy going into a squat, he's going to need to pop out of it, so it may be okay to let the feet do that, because they're getting, that mechanical energy so that they can, pop a little bit harder. And so I think that I love that, because it's really, we don't have to be in this perfect posture to squat, how can we do it where it's not symptomatic? And, and you've done such a great job with that. I love the idea of loading, especially as you're moving into these functional activities. And what strikes me is the things that you're working on with him is actually setting him up for success on his trip.
Yeah. Oh, with the luggage and everything?
Yeah, because if you think about it, what is he going to have to do? He's going to have to carry heavy suitcases, or he's going to have to pull them. He's going to have to walk with them. He's going to have to get them on and off the baggage belt. He's going to have to put things overhead. He's going to have to, he's going to Europe. So you're going to get up a couple of times and get things down from overhead. So all of that stuff is, amazing. And he's going to be able to do it with heavier suitcases. So it's not just the art boxes. Now it's variants. It's suitcases, bags, shopping bags, all of these things, and all the functional movements you need to do to get on and off the subways and on and off the trains, and, the walking on the different surfaces and all of that stuff that he's going to be engaged in. And I think that's fantastic, as a way of kind of beginning to start his body into some different stuff before he heads into judo.
Yeah.
Have you guys talked about what judo looks like, and basic exercise to start scaling the judo up? Because that's fascinating to me.
Yeah, I mean, no, I did. I actually watched some videos he sent me, but we have not had that discussion yet. I mean,
It's crazy.
I mean, it's bare feet, obviously,
Mm-hmm.
right? So, and he's going to be teaching it, but he needs to demo. I mean, the guy's 60. So it's almost like there's so much rotational movement in judo, and then I don't know much about judo, so I'm just watching what
I
he's
don't either.
everything.
That's what I was asking. I'd have
I mean,
to look
he
at the
has
movement patterns.
I mean, it's a lot of it's almost like a bow and arrow. You're taking one arm back and then the other arm back, and he needs thoracic rotation, which he has. He's got pretty good,
Mm-hmm.
sitting and standing. And a lot of it is also, I think, bracing for a load to come at you, almost like if you he's expecting it, but he has to get his reaction time up. That's what I'm thinking, and
Mm-hmm.
I'm not a judo expert, but in what he showed me, it's literally it's the throwing, it's the falling on the floor, and I think he's done that for so many years that I don't think that he'll let himself get to that place, because he does have a prior hip replacement and a partial knee replacement on his other leg, but I think he definitely wants to do most of the movements, to be honest. So, looking at the movements of judo, a lot of it is a lot of those glides, the movement of the glides, the movement of the arms, the 3D, the slumping. It incorporates everything. It's so three-dimensional, but he doesn't necessarily. He has to lift. I don't know exactly where the lifting comes in judo. I think you have to sort of, from my experience and what I've seen, is that you're really reacting to a perturbation, a very high perturbation, a kick from somebody into your face, a kick from somebody into your gut. It's almost like you need to train reaction time and quick movement, right?
Yeah, it sounds like he needs to, will also train eccentric. Because being able to absorb that and then pop back out with the blow, which which is part of the reaction time. I love it. I love the idea too that, and this is great for everyone to hear, is we don't have to be an expert in a particular activity to be able to coach people into basic movement patterns that they're going to need and be strong in, or be coordinated in, or be functional in, whatever word you want to use, in order to begin to return to them. I think the biggest thing is, obviously you wouldn't go into a full on-mat demo day the day you walk back into the, I don't even know what they call where they train for judo, if it's a den or what it is. But you wouldn't go full out against an opponent day one, right? No, it'd be like, what are the basic movements? What are the basic exercises look like? What do you take your class through?
Yep.
What do you what does your class look like in there? When they come in, there's a warm-up exercise. There's let's do these exercises. There's probably speed movement exercises and agility exercises. So it's already broken down, which is kind of cool.
Yeah.
Because then you can say, okay, let's look at these. Which ones are, and I would even solicit his response, as you always do. Which ones do you think you're going to be good at, and which ones are you? What's concerning you? Which ones, like, it's like Dims and Sims,
right?
What feels safe in you and what feels danger in you, to look at these and kind of decide which ones do you feel empowered to start right away with, and which ones you're kind of going, I don't know about that one, and start to. Then that's a great way to kind of start to break some of those down and let him get his confidence up with them.
Yeah, that's great
as well.
Yeah, I think, at the beginning, the big dim was he just didn't want to do judo. That was his major thing, And now the fact that he actually says he wants to go back, he feels ready, that's a huge sim
that's his shift. Yeah, that shift came from him, not from you.
Yeah, totally.
You weren't training him for judo.
No.
You were training him for movement.
Yeah.
And he's beginning to move better, so now all of a sudden he feels like I want to do it.
Right. And I think that a lot of therapists get caught up in, let's put some on, let's put them on a machine or do a leg press or whatever, or get them doing a ton of squatting. That would not work for somebody like this. And he, I did do the unloaded things, the basic flies, and that's just to get him unloaded and to get his nervous system used to lifting some load in an unloaded position. And now, because his background was dance and jazz, and he's an artist, and he judo, he would be stifled in a straight plain leg press or a hip abduction. I mean, that's boring for me, to give, and it would not help him in any way. So I think that we have to sort of get out of our old, these are the typical exercises box that sometimes people get into, and focus on functional movement. And I know it's been around in our field for a long time, but I think with him, the nervous system, being creative, using the arms, using the legs, and opening up the brachial plexus and letting his nervous system just move and glide, because that's what's going to get him back to judo. And that's almost any athlete, because
exactly.
Golf, right? You're hockey and tennis and golf, you're moving, you're in 5D in these sports, right? And if you're a weightlifter, power lifter, different story. Different program, different story. And I think that we have to adapt our programs to the patients, especially their background and especially what's helped them in the past in your treatment. And that's where the interplay of therapist and patient comes in. And I need to incorporate arms with him, not just for judo, but because that's helped him in the past.
Yeah, it's really cool. One of the things that just came to mind as you were talking about, the creative person and the different things that are in his world, because he's got this music background and he's got this dance background and he has this judo background and he's got this art. This guy is like, he is one of those souls that lives in those worlds, which are just amazing to me. But it might be interesting to see. One of the things I do when I try to get people to be a little bit more creative, because oftentimes when you ask them, how would you do this, or what would you do different to do this, they get a little stuck till they kind of get some confidence in thinking outside the box, like, oh, I don't have to bend over the same way every time. I can actually bend this way. I could actually move this way. It might be kind of fun to set up his art in a three-dimensional way, or where he's in the middle. He could either do it in an arc, or he could do it like set up his canvases like around a semicircle, or around him 360, and actually do some of those judo moves with his paintstick and paintbrush and just put a bunch of wax paper down on the floor, or so you don't destroy your whole studio. But he could and see what comes out. That might be kind of fun, and it might and he may look at you and go, no, I wouldn't want to paint that way, but then he may think of something else. And so I kind of use some things that I think might be kind of interesting and cool, and sometimes they're like, that doesn't really speak to me, but however, I think if I did this and this and this, and then all of a sudden their creative door got opened and now they're off to the races. And it really, 'cause I'm not tied to that idea. I just wanted to throw something out to see what he would think. But, to put his creative work into some of those movement things, so that he's not always, so that he's painting in a different way.
Great idea.
May open him up to his straight, painting where he stands in front of the thing different. I don't know. It's tricky. It's like treating, I think probably any instrumental musician, learns from tradition.
Yeah.
Rather than, from creativity and for what works for their body. And many of them are trained as very little young children, to move in a certain way, and they follow their maestro, and that's, that becomes their law for them. And so if their maestro says you take a break every 50 minutes and you do something different for 15 minutes and it comes out of their maestro's mouth, then they do it. If it comes from anybody else, they just look at you and think, I have to train this way because it's my maestro. So sometimes creative people are pulled by what they think is how they learned. They learned from a tradition. They learned in a traditional sense somewhere from somebody, and that particular kind of person really gets pulled back into that. That becomes their driver, in many ways as to certain things. So when you can kind of begin to peek open and get them to think a little bit differently about some of the things that they do and see what process it opens, he might come up with some really cool things, to assist you with, and say, okay, that's great. I love that move, but load it. I want you to do it with this now, so it's harder and you have to work for it a little bit more and you have to change your reaction time a little bit, so that could be kind of fun too. I was also thinking about, I wonder what would happen if you put one of those long swords that everybody's running around with these days.
What do you mean? Like a body blade? No.
You could put a body blade, but they also, I'm going to say the name of the sword wrong, like a Jinsu sword.
Oh, yes.
So I'm just wondering, just hand it to him. Say, move with that. Let me see you
Yeah.
move.
Oh, that would be
And
cool.
just see
Yeah.
what comes out. You can even do that with a dowel stick. It doesn't have
Yeah.
to, if you don't have something like that.
Yeah.
But I'm just thinking along his martial arts background, it'd be kind of cool if you had a curved,
Yeah.
something that you can hand him and
That's
say,
cool.
let me see you move with this. Just think about some ways that you would move, like defend, attack. Let me just see what that looks like,
Yep.
and just kind of watch and see and say, what feels right? What feels, not right? Where do you, where do you need to kind of work?
Yeah.
That would be
That's
kind of fun
awesome.
too.
Yeah.
Yeah.
You know what? That's a great idea. I think we may have something similar. I'm thinking of the minute you said sword, I'm thinking of, I'm on my Game of Thrones. I'm thinking of Arya's needle. We're recording this right before the first episode of Game of Thrones.
That's right.
That's crazy. What I was also thinking was putting him in, like a semi-lunge, like whatever lunge position he needs as that judo, that's that classic pose. And then just having him close his eyes and just do perturbations with him, but heavy, taking the visual eyes open, eyes closed, sort of your classic, proprioceptive activities. And but with him, making it hard because these people are going to come at him hard.
Yeah.
And I think that is also something I would be thinking of doing. And I do think he's going to do okay with all this. I just have a gut feel. What was concerning to me at the beginning was these neck spasms that we talked about in the last podcast, and knock on wood, he hasn't had one in quite some time. So I think that this part going forward is going to be fun to do a lot of these activities. I'll get that sword. That'll be kind of cool. And, I'll just have him do a lot of, squatting and overhead and different rotational. And, he's pretty creative. So I'm sure he'll be telling me what to do.
Right, exactly. So I think it's just how do you get the door open? How do you get them permission to unlock that creative side of their brain, get away from the maestro traditional teaching, and show me what, just begin to start exploring some new ways to do things. You might even just drop a paintbrush in his hand. And
New
say,
and novel ways.
let me just show, you don't have to just show me how you like to paint. I want to just see you move and paint, and you may be able to encourage him to maybe you should just sway with that a little bit. Do you like music? Do you listen to music when you paint? Let's turn some music on. Yeah. because maybe that does it and pulls him out of his,
he loves music.
Kind of twist posture or something that he may get into without even realizing it, so to me, that's when I have the most fun as a PT. This is, the states that I love. It's just let's see what you can do.
Me too.
So awesome. Cool.
I think I've got enough to work with.
Yeah. I think this is good. I think we've taken him all the way from not being able to, being afraid to move and do anything at all, including lifting a box.
Yep.
To where you're ready to start exploring judo for the first time.
It'll be great. So hopefully I'll see him before he goes on his trip to Italy, and at some point I can do a quick update on him in our future podcast. But
sounds good.
I hope everybody enjoyed this one, and thanks for listening.